number 7. And for our diagnosis, after evaluating the clinical scenario manifestations, we found that our patient has a pulmonary disorder, more specifically, a restrictive lung disease called bronchiectasis, which, according to the Cleveland Clinic, is a lung condition where your airway becomes damaged and widened. The damaged airways can't clear the mucus like they're supposed to, which results in bacteria growing in the mucus, causing more inflammation and damage to the lungs. So, our clinical scenario manifestations are chronic productive cough, expurgant of purulent sputum, history of TB infection, bronchioscopy, demonstrates chronic structural changes. So, a chronic productive cough is the primary symptom to look for when it comes to bronchiectasis. It is the body's response at attempting to remove the infected mucus. Bronchiectasis is also associated with expurgant of purulent sputum. An expurgant, according to the Cleveland Clinic, is a medicine that you use when you have a cough that produces a mucus, and it works by thinning the mucus to make the cough more productive. So the expurgant would be taken for the high volume and foul smelling purulent sputum. And tuberculosis is a disease that can cause bronchiectasis because it causes the initial damage, which starts at the cycle of bronchiectasis. And the bronchioscopy, demonstrating chronic structural changes, is another manifestation of bronchiectasis because the chronic inflammation of the bronchi destroy the elastic and muscular parts of the bronchi walls.
Okay, so the way I want to describe the cellular mechanism is in two phases. So, being that the patient had a history of tuberculosis, the way that the immune system addresses a tuberculosis infection is it walls off the infection in capsules known as Goan bodies. So, there's an X ray that shows that Goan body. So, the lungs do not have a lot of space in their interpleural tissues. So it would cause an airway obstruction. And so that airway obstruction in the lung tissue would cause a localized inflammation response. And so those cytokines that are released through the inflammation would possibly lead to epithelial damage. So a quick review of the lung tissue is you have epithelial cells with cilia on top, and you have goblet cells producing mucus. Those two things together create a mucociliary escalator. The mucus traps pathogens, and the cilia sweeps up the pathogens up and out of the lungs. With the epithelial cells damaged, you do not have that cilia to sweep the mucus up and away and out of your lungs. So that leads to the excess mucus, which restricts the airway. And you also have the pathogens in the mucus just continuously replicating and causing further infection. So the second phase is that this is a chronic condition that continues to repeat, and so you have an ongoing inflammation cycle, and you have repeated opportunistic infections. So with that continuous inflammation and infection, you have a now permanent airway remodeling, so that airway is now permanently dilated. However, the excess mucus restricts it.
Symptoms of bronchiectasis can take months or years to develop and can gradually worsen over time. The primary symptom is a chronic productive cough. Other signs and symptoms include large amounts of foul-smelling expectorants, purulent sputum, shortness of breath, fever or chills, wheezing or whistling sounds when you breathe, chest pain, hemoptysis, and clubbing of the fingers, which is generally from chronic hypoxia. Complications of bronchiectasis include pneumonia, lung abscess, empyema, septicemia, respiratory failure, and cor pulmonale. Bronchiectasis is commonly associated with other respiratory conditions that involve chronic bronchial inflammation, such as atelectasis, aspiration of a foreign body, infection, and cystic fibrosis. It is also associated with systemic disorders such as rheumatological disease and inflammatory bowel disease, as well as immunodeficiency syndromes like AIDS and recurrent lower respiratory tract infections.
Lung infections tend to be a common complication with bronchiectasis, so the goal of the treatment is to treat these infections as well as decrease further complications. The first step after a bronchiectasis diagnosis is to obtain a sputum culture to identify any lung infections. Then we'll treat these with use of antibiotics and anti-inflammatories like bronchodilators. And then a very common form of treatment is chest physiotherapy. This is typically done by healthcare professionals just to loosen up the mucus and make it easier to cough up. There are gravity-based forms of this that can help the patient by laying upside down to drain the mucus up and out of the lungs. If bronchiectasis becomes severe enough, the supplemental oxygen may be required if respiratory failure occurs. It is also important to acknowledge that there are preventative treatments to avoid those predisposing factors, like maintaining good health, avoid the use of cigarettes or other smoking devices, and staying hydrated. And these are our sources.